Hello. Hello, everyone, and welcome to the S&P Senior Medicare Patrol podcast, Sip and Learn with S&P. Thank you for joining us today. I am Johnetta with Senior Medicare Patrol. I am the Community Outreach Specialist for the Mississippi area. We also cover the state of Georgia. So today we're going to talk about the S&P program. We're going to tell you who we are and what we do, and also give you a general overview about our program.
And I'm Brenda. I'm the Community Outreach Specialist for the Louisiana area. And before we get started, I need to let you know that this project is supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services, Washington, D.C. Senior Medicare Patrol, S&P, is sponsored by AdviseWell. So let's get started today with our podcast, Senior Medicare Patrol, Sip and Learn with S&P. Johnetta, can you tell us what is the Senior Medicare Patrol program?
Sure. The Senior Medicare Patrol, also known as S&P, is a federally funded nationwide program. Our goal and our mission is to empower and assist Medicare beneficiaries, their families, and caregivers on how to protect, detect, and report healthcare fraud, errors, and abuse. We do this through community outreach, counseling, and through education. So that is our mission and the definition of who we are. Mm-hmm. So Brenda, tell us, what does Senior Medicare Patrol do?
Well, as a community outreach specialist, we go out into the community to spread our message to different audiences. We do presentations, attend health fairs, we do health expos. We go and reach out to senior centers and senior organizations. We participate on panels that we may be invited to talk about healthcare fraud and scams. We also do radio shows and TV shows. Anywhere we're able to get our message out, we'll attend, and we try to be there. We try to take advantage of all the opportunities that are presented to us to make sure that people are aware that our program is here to help them. We also want to let people know that we are a free resource to them in our communities in case they become a victim of a healthcare scam or just Medicare fraud. If they want to report something because they suspect that it could be a possible fraud or possible scam, they can give us a call to our toll-free number at 877-272-8720 to report it. So I said and spoke about healthcare fraud. Johnetta, can you tell us a little bit about what the definition of healthcare fraud is?
Sure. Okay. Healthcare fraud. Let's just begin. Let's give an example of healthcare fraud.
Okay.
An example of healthcare fraud would be if a person is being billed twice for an item.
Okay.
Or maybe they're being billed for an item that they didn't receive. Mm-hmm. Also, it could be they're being billed for services that were not ordered by an actual physician or not ordered by their physician. Mm-hmm. So those are just a few examples of healthcare fraud. Also, we want you to remember phone calls. When someone is offered a free back brace or a free knee brace and their Medicare number is needed, please be aware. It may not be free. They may be billing your Medicare number. The marketing tactics that are being used are confusing, and they are confusing on purpose. And the Medicare beneficiary could easily give out their personal information as well as their Medicare information and their Medicare number. Mm-hmm. Remember, never, ever give out your personal information to anyone, especially over the phone. No one should have that information, especially someone that you don't know. So please, we want you to be aware of that and be careful. So Brenda, tell us, how can I find out if my Medicare number was stolen or compromised?
Okay, that's a good question. To find out if your Medicare number has been compromised, you can just go and check your Medicare summary notice, or what we call an MSN, or your explanation of benefits summary if you are on some type of Advantage plan. We teach our beneficiaries to be proactive in this. We teach them to look for errors and inconsistencies on their Medicare summary notices or their explanation of benefits. We ask them to check to make sure that their name that is listed is correct and that their address is also correct, as well as their doctor's information. This is where you're going to look to find those inconsistencies, to find any errors. When you receive your statements, we ask the beneficiaries not to throw them away, because it does say on your statement that this is not a bill, okay? So we tend to want to throw away anything that we get or that we just don't understand and we just discard it. But we ask that you keep it just in case you have to refer back to the statement in the future. You should be checking for things such as being billed for items, like you said, that weren't received, or being billed for items that weren't requested, or for items that you didn't order. Check over your statement and just make sure that everything is correct. And if you have questions, you can call us at that same toll-free number, 877-272-8720. Don't be afraid to question something, even if it's correct. Question it if you don't understand it. And if you can't call your provider to question it, call us. We'll step in on your behalf with your consent to make sure that the billings that are showing up on your statements are correct. We may just catch something that isn't supposed to be there, and because of your phone call, you've reported something that's important.
Yeah.
Okay. So, Janetta, how much money, because I get this question a lot, how much money is the Medicare programming losing? Is there a charge to S&P to help a victim of healthcare fraud?
Okay. Yeah. Great question.
Mm-hmm.
Currently, the program is losing an estimated $60 to $90 billion per year annually. It's a lot of money.
That's a lot.
A lot.
Billion.
It is. And because this is so hard to measure, we do believe that number is way higher. Yeah. And is there a charge for our services? There is never a charge for S&P to help you.
Mm-hmm.
We are federally funded with a government grant, and this allows us to go out in the community to spread the message on how to protect Medicare and the Medicare program from fraud, waste, and abuse. So our services are free of charge. Again, as Brenda stated, you can give us a call at 877-272-8720, Monday through Friday, Central Time, and leave a message. If you call after hours, you definitely can leave a message and you will receive a return call, and we'll be glad to help you.
Mm-hmm.
So Brenda, who can people call to report healthcare fraud or a compromised Medicare number? Who can we call to report scams, waste, and abuse?
They can call us, the Senior Medicare Program, to report any type of fraud, waste, and abuse. I want to mention that the S&P program is in all the 50 states. So each state has an S&P program, and also the U.S. territories like Puerto Rico, U.S. Virgin Islands, it's Guam. It's very important that you reach out to your local S&P. Now, we cover 3 states. We cover Louisiana, we cover Mississippi, and we cover Georgia. So the number that we're giving to you, you can call and report any type of fraud, waste, and abuse that may be occurring in any of those 3 states. If you think you've been a victim of healthcare fraud, or you think that your number was compromised, please call us. Like Janetta said, our number is toll free, 877-272-8720, Monday through Friday, 8:30 to 5 o'clock Central Time. Like she said, if you need a call after hours, at night, or on the weekend, you will get a call the next business day. And it will be very personable. It's not like you're going through a computer system or waiting, for 10, 15 minutes to get an answer. No, it'll be quick.
Right.
You can also visit our website, Our website is stopmedicarefraud.org. If you just want to go and navigate and see what kind of work it is that we do or what kind of projects we put out there. During the pandemic, we've been able to do a lot of things virtually, so that's helped. In case people can't get out, they can just visit our website and get information there. We're also on social media. Each state has their own page, and now you can listen to what it is that we do through our podcasts, which is this one's the first of a series to come. It's Sip and Learn with SMP. So if you are listening to this podcast and you don't live in one of the three states, Louisiana, Mississippi, or Georgia, you can contact the SMP National Resource Center, okay? You can call them at 877-808-2468, or you can also go to their website, which is smpresource.org, and they will connect you to the national, to your local SMP program, and let you know exactly what it is that who you have to talk to when it comes to your particular state.
Right. They'll direct you directly to your state. So that's great. Okay.
So give us our 3 key prevention tips.
Sure. So we have 3 key prevention tips that we like to tell everyone and remind everyone throughout our podcast. So now that you're familiar with our program, we want to remind you of these tips. And the first one is to protect your Medicare card and your Medicare number. Treat it like a debit card or treat it like your credit card. Keep it confidential. And the next one is detect. Keep track of your doctor, clinic, and hospital visits and compare them. Compare those statements to your MSN, your Medicare summary notice, or your EOB, explanation of benefits. And those are the statements that you receive in the mail. The last one is report. If you detect something on your Medicare statement that is not correct, report it. And you can do that by calling that toll-free number, again, 877-272-8720. So remember those 3 things. They are protect, detect, and report. Okay. That was a little bit of information again about our program. We want to thank you so much for tuning into this episode.
Yes, and by listening to our program today, if you call that number 877-272-8720, we can send you your very own healthcare tracker. It's like a little journal, a little booklet where you can keep track of all your doctor's visits. And that way, when you do get your MSNs, your Medicare summary notices or explanation of benefits, you can compare to see if the dates match and all of that good stuff. So it's free by calling 877-272-8720. Let us know that you listened to our first podcast here, and we will send you your free healthcare tracker. And we hope that you join us again for our next podcast, Sip and Learn with SMP, to learn more about some SMP content and information of new topics of interest to you.
Yeah. So thank you, Brenda. Until
Thank you,
next
Donata.
time, stay safe.
Thank y'all. Bye-bye.